And we got to figure out as a hospital how we can provide services to the community despite what people choose to do for their personal belief.
We've heard it repeatedly over the last few weeks. Hospitals are overwhelmed, but what's it like inside? Tonight we're hearing from one of our healthcare workers on the front lines in a story you'll only see on Krem. Kids head back into the classroom. Rising coronavirus numbers are becoming a major concern. We're talking all things kids and COVID tonight at 5.
Despite the cool temperatures of the last couple of mornings, summer's not over yet and attracting some warm weather for the holiday weekend.
Good evening. Thank you for joining us here for Krem2 News at 6. I'm Whitney Ward. Mark is off tonight. We begin with some breaking news. One person has been shot in downtown Spokane, and a manhunt continues as police search for the suspect. That's where we find our Ian Smay live tonight. Ian, what can you tell us?
Whitney, this all happened at about 4:30 this afternoon here at Riverside and Howard. And as you said, one male victim has been taken to the hospital with non-life-threatening injuries. We actually have a map we want to show you now to show you exactly where this all took place. Again, police are still on scene here at Riverside and Howard outside of the Bank of America building. Officers were able to respond quickly because they were already in the area, and they actually had gotten calls from security guards from the bank reporting the shooting. We spoke to police earlier about how that all happened. Take a listen.
Security from the bank called and said that there had been a shooting. Officers were very nearby. It was our downtown NRO units. They happened to see the victim who was uncooperative. We were able to locate the victim and get him to the hospital.
This is still an active crime scene at the moment, and major crimes detectives are investigating exactly what happened down here. Police also said earlier that they are working to establish probable cause to arrest that suspect, but they have not yet really released any identifying information about who they think fired the shots down here. And there are no road closures. Traffic is moving freely in the area, but do expect police presence down here by Riverside and Howard for some time. Reporting in downtown Spokane, Ian Smay, Krem2 News.
All right, Ian, thank you very much. Our other top story tonight, extremely high hospitalization rates continuing to overwhelm our local hospitals. As we take a look at the numbers right now, the Spokane Regional Health District reporting 224 people are hospitalized in Spokane County tonight. 391 new COVID cases were also reported today, along with 2 new COVID deaths. And just over the state line, the Panhandle Health District reporting 104 people are hospitalized with COVID. There are 309 new cases reported today, just since yesterday, but no new deaths today. And as the new case numbers rise, our local hospitals are making no secret of the fact that they are overwhelmed. I had a chance to sit down and talk with one-on-one with an ER nurse at Deaconess. She tells me they're doing the best they can, but the strain is real, and it's likely going to get worse before it gets better.
Over the last 3 to 4 months, it seems like things have just been extra stressful at the hospital. Part of the problem is the hospitals are so full. So every day when I come in, we have 23 beds in the ER, and sometimes 23 beds are full of hospital admitted patients that are waiting to go upstairs.
People have so many questions when they hear about all the hospitals being stressed. What does that mean for you working in the ER day in and day out?
So we're trying to get really creative here to see how we can still see the ER patients.
What does that mean, getting creative?
We've made 11 hallway beds. Pretty much anywhere there's a wall and we can put a bed, we'll put a bed. And sometimes we see patients in chairs. We've created areas in the waiting room to see patients, also trying to maintain their privacy, of course, but we just got to get creative. We got to find space to see everybody and take care of them.
Do you think people outside in the community who aren't part of healthcare really understand how bad it is?
No, and I think what's really important, what I wanted the community to know, is it's not just our COVID patients. Like, yes, that's making things difficult. We're still recovering from last year, the shutdowns.
Is this the new norm?
I hope not, but I mean, it is going to be for a while. I mean, even when the COVID numbers go back down, I mean, we're canceling surgeries left and right to just try to control the flow and the amount of patients in the hospital. So we're going to be recovering from that for a long time.
So we've also heard about how dire it is in Idaho, North Idaho specifically. How has that played a role? Are you guys getting patients from across the state line?
I think yes. I mean, we always have, we kind of share our community because we're so close. I know as one of the lead charge nurses in the emergency room, every single morning I meet with every charge nurse of every floor. I meet with the OR team and we talk about how many rooms we have available, the outlying rural hospitals that need to send people in, and that's also challenging. Sometimes they don't have anywhere to go.
Do you feel that vaccinations are kind of the ticket out of this situation?
I think that the vaccination seems to be such a hot topic for everybody right now, right? I mean, I'm vaccinated. I feel like I'm doing what I can to help take care of people. I'm going to take care of people no matter what.
Because once they come through your doors, politics aside, right? I mean, you just want to take care of patients.
Oh yeah, definitely. And that's how it's always been. That's how we always believe. Every nurse feels that way. It doesn't matter what your health insurance is or if you have none. It doesn't matter what your political stance is. If you're vaccinated, we're here for you.
Is there anything else that you want people to understand about just what it's really like? You know, we're out here right now. It's a beautiful day. It doesn't feel scary in any way. But once you go through those doors, it's pretty serious, isn't it, right now?
It's very serious. I know personally a lot of the nurses are having a really hard time coming to work. I think one of our biggest challenges is knowing the care you want to provide, but not always being able to provide it because you're stretched so thin.
And we have also seen more kids hospitalized here locally with COVID. And because of that, back to school means anxiety for a lot of parents. In Idaho, where there are almost no restrictions, pediatricians are now sounding the alarm that kids are vulnerable at a time when hospitals are full. In Washington, however, the state's top doctors said today they are confident the protocols put in place here will keep children safe. So Casey, what gave them that confidence today?
Well, Whitney, in Washington schools, everyone needs to wear a mask. All school employees must be vaccinated, and there will be social distancing, ventilation, and sanitation protocols. We learned just this morning that, in fact, Washington state agencies are currently working to release new specific guidance that will come out after Labor Day. But the way the state's chief science officer described this situation, it's kind of like driving a car. It's dangerous, but there are ways to lessen that danger with the equivalents of seat belts and airbags.
We don't know the effect Delta is going to have on kids. Everyone is watching the number of pediatric hospitalizations. We're watching the number of pediatric deaths. And just a reminder, that number remains incredibly low. The hospitalizations and deaths remains incredibly low for pediatrics. Underlying conditions, unvaccination are the main drivers of these deaths across the country. But again, we still have tools. Don't forget, for parents, we have these tools that we know work. Things like masking, social distancing, vaccination, all these efforts we have to mitigate the risk in kids.
Now, of course, kids under 12 still aren't eligible for the vaccine. Health officials said today that makes it all the more important that everyone around them gets vaccinated, so we can just protect kids by surrounding them with vaccinated people. The state health officer also said families can and should take action to protect kids outside of school. Besides being vaccinated, they can avoid travel and large gatherings, make their playdates small and outside, and get tested whenever they feel sick. In the newsroom tonight, Casey Decker, Krem2 News.
All right, Casey, thank you very much. And just a reminder, the deadline is quickly approaching for state and school workers to get vaccinated per Washington Governor Jay Inslee's new mandate. If you are planning to get the Moderna version of the vaccine, you're going to need to get it by Monday. That's Labor Day if you want to make that October 18th deadline. For Pfizer, you'll have an extra week. And for the J&J shot, which is, of course, just one dose, you have until October 4th. And if you would like the latest information about coronavirus here in our community, you can always head to Krem.com or you can text the word COVID to 509-448-2000. We'll send that link right to your phone. As we take a quick break from the headlines, another chilly start to the day, but boy, it warmed up beautifully. Meteorologist Michelle Boss is in for Tom Sherry tonight. Did we make it out of the 70s actually?
No, so our high today was in the mid-70s, so we have had some chilly mornings. Spokane, not so bad this morning. We were in the mid-40s, but we still had a few locations up north which dipped down into the 30s, places like Sandpoint. I think Deer Park bottomed out right at 40 degrees. So kind of a cool start to the morning, but temperatures are warming up, and you can see some 80s right now across central Washington. Currently 80 in Grand Coulee and in Moses Lake, 81 in Omak. Temperatures a little bit cooler across the Idaho-Palouse. Moscow checking in at 67 degrees, 10 degrees warmer in Lewiston. But plenty of sunshine for everybody. We had a few afternoon cumulus clouds across the mountains of northeastern Washington and the northern panhandle. Those will be dissipating this evening, and looking for mostly clear skies overnight and some mild temperatures. This has slipped down into the low 60s by 10 p.m. Overnight lows will be in the upper 40s and lower 50s. Tomorrow looking just gorgeous. Sunshine, 78 degrees and light winds, and the beautiful weather will continue right into the holiday weekend. Team Summer is going to be bringing those warm temperatures back Saturday and Sunday, seeing above average temperatures in the low to mid 80s with partly cloudy to mostly sunny skies.
Couldn't have drawn it up any better, Michelle. Thank you very much. Well, Spokane's hottest housing market may be turning into one of the most overpriced markets in the country. We'll explain why next as part of our ongoing Boomtown coverage. Plus, later in our ongoing Scorched Earth series, we're talking about fire season, evacuations, and how not everyone may get the notification to leave their home. I set out to find out why when we come back after the break. Before we go, though, it was the first day of school for thousands of students across the area, and we want to celebrate your kids. So please send us your first day of school photos, whether they're from today or maybe just a long time ago. We love to see them. So text them to us right now, 509-448-2000, and we might just feature them right here on Krem2 News. We're back after the break.